Now come to the reflux esophagitis. It is also known as the gastroesophageal reflux disease. There are a number of the factors which is preventing the upward flow of the gastric content into the esophagus. So this is the proximal esophagus, this is the distal esophagus, this is the lower esophageal sphincter, and this esophagus is composed of the stratified squamous epithelium. And in the proximal part and the distal part of esophagus, there are some mucosal glands which are producing the mucin and the bicarbonate, which are continuously neutralizing the gastric content or the gastric juices. But this main role is played by the stratified squamous epithelium, which is the resistant to the abrasion from the food but sensitive to the esophagus. And the lower esophageal sphincter is also plays an important role in the upward flow of the gastric content. And the disease, the GERD, is caused by the transient lower esophageal sphincter relaxation. These relaxation is mediated by the vagal pathway, but there are a number of factors. These are triggered by the gastric distension, either by the gas or the food, stress, mild esophageal stimulation, swallow-induced lower esophageal sphincter relaxation, or the forceful opening of this lower esophageal sphincter due to the increase in intra-abdominal pressure in the case of the cuffing, bending, or the straining. The number of other factors like alcohol, obesity, tobacco, CNS depressants, pregnancy, hiatal hernia, delayed gastric emptying, and the increased gastric volume. And in morphology, we will see the simple hyperemia. In the mild cases, there is no significant findings, but in the severe cases, we will see the eosinophils in the squamous mucosa of the esophagus, which is followed by the neutrophils. The main important thing is the presence of the eosinophils first, and then it is followed by the neutrophils. We can also see the basal zone hyperplasia, which is exceeding the 20% of the total epithelial thickness. And there will be also the elongation of the lamina propria papillae. The mucosal injury in the GERD is basically due to the reflux of the gastric juices. But when there is a reflux of the bile from the duodenum, it will exacerbate the damage. Clinical features, it will present in the people older than the 40 years. Heartburn, dysphagia, difficulty in the swallowing, regurgitation of the sour tasting gastric content. And in the chronic cases, there will be symptoms like MI, severe attacks of chest pain, and the complications include the hematemesis, presence of the blood in the vomiting, melena, stool containing blood, stricture development, constrictions, Barrett esophagus. And how the hiatal hernia will cause the reflux esophagitis. The hiatal hernia will produce the symptoms which are similar to the GERD. In the hiatal hernia, basically this is the diaphragm. This is the diaphragm, and this is esophagus, which is passing through the crura of the diaphragm. This is the diaphragm, and these are the crura of the diaphragm. This is the esophagus, which is passing through this crura of the diaphragm, and this is the stomach. And in the hiatal hernia, there is a separation of the diaphragmatic crura and protrusion of the stomach into the thorax. If it's a hiatal hernia, what will happen? Like this. In the hiatal hernia, this will like this. Okay. So there will be a upward movement of the gastric content into the esophagus because of the obstruction at the level of the diaphragm, or sorry, not obstruction, constrictions at the level of the diaphragm. So that's all about GERD.